shows you there's different bases. If somebody wants more cleavage, then we use a wider base implant and not dissect laterally so that the implant stays in the middle, gives you better projection. These are examples of different implants. This is a round implant. There's a smooth surface and a textured surface. And some studies show that textured surface has the advantage of less capsular contracture than the smooth surface. However, there's a higher chance of rippling because the texture of the implant sticks to the skin and might give you a higher chance of rippling. There's other studies that dispute these facts, so that there's no clear-cut picture, and 95% of what we use is smooth implant because it's my belief that the smoothness of the implant flows better with the shape of the breast, and it's not stuck to the tissues around it, so it gives you a better look and feel. This is the anatomical implants. If it's silicone, it will make a difference. In my opinion, if it's saline, it's only more expensive without making a difference, because when it's saline, it's a pocket of water. It's a balloon of water that we put in there, and the forces of the body is going to change the shape of this implant. This implant is not going to change the forces of the body. There's the muscle, there's the skin, then there's the elasticity of the surrounding tissues. And the negative thing about anatomical implants is that if it shifts in thin people only, which it might shift, then we have a problem. This is the different implants. There's a double lumen implant that has silicone and saline that was introduced to the market. However, it has failed, in my opinion. Textured surface implants we talked about, and then the most common one is the inflatable saline implants, which is used in 95% of breast augmentation. Although, like I said, it will change since the FDA approved the silicone use again. The silicone implants were first done in 1970s, late 60s and 70s. There was a report of the gel bleed, and it is said that the chance of them leaking is 100% with time. However, when it leaks, it's an intracapsular leak. It's more of a bleed that stays inside the capsule, and which is a collection of collagen tissues that is produced by the body to wall off this foreign object. So if it does bleed, most of the time it stays in there. And if it does leak outside there, it has been proven that it doesn't cause any of the diseases, the cancer, the autoimmune diseases that they thought it did. The texture here, some studies that were done in '94 that shows here 2% versus 40% in the chance of capsular formation. However, another study in '97 that was done in Sweden that disputed that.